guys, welcome to yet another episode of Pulse of Wisdom, and today we have here with us Dr. Shobha. She is our resident dentist over here, and she has been with us for quite a long time actually, and in between she had to take a small break, and now she's back with us. She's a general dentist at Pearl Dental Clinic. Welcome, doctor.
Thank you so much for being here.
Today the topic of our discussion is Invisalign. So one of the treatments that we provide at Pearl Dental Clinic is Invisalign.
Yeah.
And recently we moved a tie-up. That's we are an Invisalign Platinum provider.
Yes, that's such a good news, you know.
Yeah.
I guess congratulations to you,
Thank
doctor.
you. Thank you. I've been doing Invisalign for 15 years now.
Okay.
So within this time of 15 years, it has different tires like bronze, gold, silver, and so on and so forth. So now we are in Platinum. So which means it is also a testimony of the number of cases that we have did so far. And we are growing.
So how you feel now, doctor?
Yeah.
How about your journey now? Like how you feel about it?
The reason why I started Invisalign journey was to give more to my patients. My specialty is aesthetics and restorative. So I do a lot of aesthetic works. So in order to have it perfected, I need some amount of movements. So I had to deal with orthodontist for braces treatment and all that.
Yeah.
So the thing is, sometimes it's difficult for me to convey what I exactly want, because when we come to the restoration, I'm generally facing certain issues. When I heard that there is something like Invisalign, I really wanted to get on it, because then I'll have full control on what I exactly want, where I want it. So I can, at the end, when I'm doing the final restorations, it will come to the exact way that I want for my patients. So that's how I started off.
Okay.
So I wanted small cases. Bigger cases, major cases, I would trust an orthodontist to do it.
Okay.
But smaller cases, easy cases, I would prefer that I do it, and I can complete that with veneers or any composite bonding or whatever.
Okay.
And this we are talking in like quite long time ago, and there were hardly very few doctors actually doing Invisalign. So that's the time that I have started practicing Invisalign.
Oh, that's great.
So, and back then when I tell my patients there's something like this, it becomes for the patients it's like something new, totally new. They never heard of it, and then I had to sit down and explain what it is. Then compared to now people come here and ask, do you do Invisalign? Or if I say like, okay, we can do Invisalign for you, there's no other questions. Most of the patients know what Invisalign is. Back then, it was like an amazing thing. Like, wow, this small plastic can move the teeth. Like this one, it was like completely something new. Especially for those patients who didn't want braces. So obviously my first choice is always braces when I talk to my patients.
Yeah.
But when I say, no, I don't hate braces, I don't want braces, I want to go for veneers directly. I don't mind you shaving my teeth down, cutting, to have it perfected. But then I tell that's not how veneers work. We need to do very minimal preparation with very, very little destruction. And when we place the veneers, it will have a very good bonding. It will stay very nice. And this is what we want. Yeah. But sometimes patients, because they don't want to go with the braces and it will take a long time, maybe they will need to wear the braces for maybe 8 months to 1 year, a whole year, that they need to live with the braces as an adult, because these are people who have daytime jobs. They are into sales, marketing, they meet a lot of clients, they are meeting a lot of people, and they don't want braces in their mouth. The very purpose that they came for veneers is so that they can have a very beautiful smile. They can close the gaps or crowded teeth. They can align them nicely, just place braces, and that's it. And then their confidence goes up, and they can meet like a lot of people, right? So, but as a dentist, my major challenge is to shave a healthy tooth down, and more of it, especially if it's crowding. I'll need to cut down a lot of the tooth structure. So, and then it can result in sensitivity, and sometimes it might be too close to the nerve that we will have to do a root canal treatment for the patient. By aligning the teeth with the braces, the teeth are are very well aligned. Then we can control the amount of the teeth that we need to shave down. And sometimes we can also do without even shaving a teeth down. So with a minimal prep or no prep at all. So when an Invisalign came out, For me, it was a big thing, and even for my patients, because like they are interested in doing the Invisalign.
Okay.
And they are very happy to have their teeth aligned before they can go for veneers. But something else also happened. Like patients, once their teeth were aligned and very clean and clear, and they are happy with it, that they don't want to go for any veneers after that. So that was also a good thing.
Okay.
So all my journey, like when I started off, this was the first defining moment of like explaining to the patient how this works and everything. And it was interesting. Of course, I had my doubts, but I knew the product. We had to go through a training, so I could see some before and after. I met some of the doctors and I went through some of their experience. So that gave me a little bit of courage to start off with something like this. But then I started seeing the results, and that gave me more courage to take up more cases and more interesting cases and so on and so forth. And then slowly Invisalign grew on me. Like then I'm able to take up even more complex cases and deliver.
That's so great.
Yeah.
And doctor, like during this time, like do you find like sometimes happen like you have to choose between braces treatment or Invisalign?
Yeah, many times, yes. I would always prefer braces over Invisalign. Actually. If it's very small, minor correction, very tiny correction, then obviously there's no point in placing the braces, because when you place the brackets, we have to do some etching on the tooth, and we have to bond the bracket to the tooth surface.
Yeah.
And when we remove them, we need to be very careful when you remove, and then we need to polish them nice and put it back to how it was before. This is the biggest challenge when we are debonding the braces. When you are removing the braces, these are the biggest challenge to bring the tooth back to how it was before we started the braces. And many a times I've seen patients who had their braces removed. There are certain scratch marks, some deformities on the areas where the brackets were placed.
Yeah.
And so when I'm debonding, I know that this is going to happen. So I am very careful when I'm trying to remove it, So, but if it's for a very short period of time, and if the Invisalign can do its job very well, maybe 3 months, 6 months, then that's the time I would say like, okay, Invisalign is good. But for a big treatment, complex cases, braces are still much preferred from my side.
Okay.
If the patient is willing to go ahead with the braces.
With the braces.
Yes.
And doctor, how about those? Like, many of my patients, they say they have small kids and they wanted to start Invisalign.
Yes.
So how about this? Like, our kids are ideal for Invisalign treatment?
Now, Invisalign has come up with the Invisalign Teen. And so many others. So these are intended for this kind of mixed dentition period and all that.
Okay.
I have not taken it up because of certain issues. Because in the mixed dentition, there is a mix of permanent teeth and the baby tooth or milk tooth. So sometimes when the milk tooth falls off, so the aligner fit is an issue. It will not stay in its place properly. So this kind of hassles are there. So I would trust this with a specialist orthodontist to have this treatment done. But after a certain age group, like at the age of 12 plus, when the patients have all of their teeth out, like all the milk teeth is gone and they have all the permanent tooth, then an Invisalign is okay. Now, here is the biggest challenge. Braces are fixed to the teeth, whereas Invisalign is a removable device. Problem with the fixed one, because it's fixed, is it's difficult to clean and eat, but it's there. But with the removable one, there's a lot of commitment because it's in the hands of the patients. So if they're not wearing it, especially for pediatric patients or children, if they are not wearing it full time, then the desired results will not be achieved. So when the children come, my first thing is to the parents. I tell the parents, are you ready to or willing to run behind your child to make sure that they are wearing? Only then you need to go for Invisalign. If not, braces is the best thing. Do the braces, then you don't need to chase them around like that. So but these children, I have done for a few children, and because I say that they are really dedicated, and I qualify them. I make sure that they are and They're so how do I know that they're dedicated? Because most of these children who come to me and they specifically want Invisalign, they don't want braces, is they know everything about Invisalign.
Okay.
They know how it works, how long they have to wear, how to take care of it, everything. They through internet, through their friends, and they know they are well prepared, even more than their parents.
Oh, really?
They come, they sit down and they explain, Doctor, I know everything about Invisalign. I know how long you need to wear it for this many hours. This is how you need to do it. We need to remove it when you eat food. We need to brush. I will do all of it. I am ready for it.
So they always come with their all research and everything, I guess.
Then I look at the parents. Well, now there's no other choice. We have to start. Are you ready? You're okay? Then the parents say, yeah, go ahead. Then we start off the treatment. Yeah.
Good. And Doctor, do you feel like these kids who comes for a treatment and adults, do you feel a difference, especially within the time period in kids, they are getting faster treated compared to adults? Because
generally, whether it's the braces or Invisalign, the movements are a little bit more faster in children.
Correct. That I want to know actually.
So because their bones are still soft.
Yes,
it's like just growing. They're in the growing phase. It's very soft. So it's any kind of movement, whether it's with the braces or Invisalign, it's faster.
It's faster,
the results
right?
are great as well. The predictability of the treatment is also very good. The only difference, like I said before, is that Invisalign, you need to wear it the longer. The more you wear it, the better the results are. So this is where the biggest challenge is, because as children, they are always eating something in the mouth. So it's always out sometimes.
Okay.
And at the school, they need to carry this to the school as well. So they might lose it in the school. So they will only get it, they'll only be able to retrieve it the next day when they go back to school. So till then, they do not have anything in their mouth. So what happens during that time? So in orthodontics, there should be a continuous movement of the tooth structure. It should be a continuous force. If you stop, the tooth kind of moves back to its original position.
True.
So the force has to be continuous.
Yeah.
So that's why with the braces, there's always a continuous force. But with the Invisalign, whenever you remove it, then the tooth kind of moves back to its position. And Invisalign being a series of aligners, it's not one aligner, it's a series of aligner. So each aligner is supposed to move the tooth a tiny bit, and the next, and the next, and the next.
Yeah.
But here the problem is that, so the trays have to fit. So if the aligner number 1 did its job, only then the aligner number 2 will fit in. Then the aligner number 3 and so on and so forth.
Yeah.
But if the wear of the aligner is not enough, when they put number 2, it might not go all the way in, or it can cause a lot of pressure, resulting in some kind of pain.
Yeah.
Then when they go for number 3, it will be even more bigger pressure, because the aligner number 1 and 2 did not do its job completely. Enough for the number 3 to have. And this is the biggest challenge. So ultimately, like what will happen is number 3 or number 4 is not going in. So we'll have to tell the patients to go back to number 2 or 1, like this way. So that, and then restart again. So these are the challenges with the Invisalign. But for children, like to answer your question, for children, it will move quite faster.
Move faster,
and
right?
the results are very nice, provided they wear it all the time.
Okay. So even like retention, what we tell about, after the treatment, so retention will be also very good in children, right?
Retention is also very good in children, because once the teeth moves to a new position, again the bone formation around the tooth in its new position is a lot faster than in an adult. In an adult, it can take longer time for it to heal around. So yes, for children, once the tooth knows its position, the new position, then it is very difficult for the teeth to move, unless as a grown-up, there are habits like tongue thrust habits.
Tongue thrust, correct.
Or any fiddling with the lips or pen or some tool in the mouth can cause the teeth to move. Mouth breathing, like if there is a nose block and they have to breathe through their mouth, then yes, the teeth can move. Then if there is any gum disease, gum problems, the teeth can move. If there is 1 or 2 teeth that's missing, the teeth can move. If there is a cavity, the teeth can move. So there are so many other reasons why the teeth can actually move. And one of the biggest things I have seen is like when there's a lot of buildup, plaque, calculus buildup, the space between the 2 teeth actually opens up irrespective of if the person has worn retainers as per recommended and everything is perfect. But if the health of the teeth is not maintained very well, the teeth can move.
True. True.
So
Correct.
every time
Yes.
that we finish off with the treatment, we thoroughly clean the teeth before we provide them with the retainers. And then we again educate the patients the importance of a healthy teeth and gums and everything. Not only to maintain a healthy teeth and gum, but also to maintain its respective positions post the treatment of Invisalign or braces.